All right, so we'll start with infection and we'll move on from there, okay?
Mhm.
Okay. Just don't worry about what's on your sheet. Just tell me what you know about infection and why we're so panicked about it in nursing school.
When we start with infection, it's like from a very basic level,
Mhm.
and for a patient or for anybody, it's not just hurting that patient, it can spread to anybody else, or it can spread to the patient's uh organs from one place to, and then it just spreads anywhere. So it's
Yeah,
just
and it can spread to you too.
it spreads
Okay.
to anyone.
So something I don't know if I said this in the video or not, but I always tell nursing students when you're a nurse and when you're a student too in clinical, watch for these. You
Um,
always want to keep your hair back
mhm,
because I worked at UTMB they had a whole hospital for kids back then.
mhm,
And so I had gone to help another girl in another unit and she was doing wound care on this kid. And so she's
mhm,
leaning over doing wound. She had her mask on and
mhm,
everything. But her hair like went in front like this. And so she went like this to pull it back.
mhm.
And she got MRSA on her scalp and she had this huge bald spot for like a year because
Oh,
it just like ate away at her scalp right there. So like you want to make sure everything is pulled back. Like I know you everybody trying to look cute, but like now's not the time. Okay.
I see.
So keep everything back because it's really gross. Okay. So you're right. It can spread everywhere. And
Mhm,
then you got to worry about your patient, you got to worry about you, and then the patient that's next to them. And
mhm.
it can go pretty much like wildfire across the entire unit. All right. So let's talk about who's most at risk. Oh, but before I do that, you know, in nursing school, you will always, always, always pick good hand washing. I don't care what question that they're asking, right? They can say, what color is the sky today? And you would say,
Yeah.
that's right. You will always pick it. It will never be the wrong answer. And you will always pick it in a select all that apply.
Mhm.
Got it?
Yes.
Okay. All right. So infection cheat sheet, we're going to start there. This is going to kind of an overview. Let's talk about everything and then we'll dig in a little bit. All right. So who's at risk? So I'm going to tell you who's at risk and you're going to tell me why you think they would be at risk.
Mhm.
Okay. Older adults, that would be over 65. Why are they more at risk of infection?
The immune system is not that good compared to how they were when they were younger.
All right. So their immune system has decreased. What organ specifically deteriorates over time for older clients? Starts the T.
See?
And it's an immune organ.
Fine.
Yes, the
Yeah.
thymus. The thymus deteriorates as we age, but especially in older adults, they don't have much of one left. And so older adults are at much more risk.
Mhm.
All right, immunocompromised. What does that mean and who is immunocompromised?
It's people who just don't have a good enough immune
All
system.
right, so who doesn't have a very good immune system?
Probably people who don't get vaccines.
Well, vaccines don't have anything to do with immunity per
No.
se, right?
Mm. I guess people who don't have the respiration.
If they
Wait.
don't have respirations, they would be dead. Yes.
Mm. People get sick a lot.
Well, they get sick because they're immunocompromised, right?
Mhm.
So you want to think about patients who are like on chemotherapy,
Chemotherapy.
right? Because that wipes out their white blood cells.
Mhm.
You could think about patients like with HIV because that's human immunodeficiency
Oh.
virus, right?
Mhm.
Patients with HIV. Patients that are on corticosteroids for a long period of time, right?
Mhm.
Because steroids decrease your immune system over time and make you immunocompromised. So basically, anyone that's ever had a transplant would be immunocompromised because they have to be on steroids for almost their entire life so they don't reject that organ.
Okay.
Okay.
Mhm.
All right. Why would chronic illness put you more at risk of infection? Like you have something like chronic illness would be something like you have diabetes.
Mhm.
Okay, so let's bring diabetes into it since we've been studying that, right? So what kind of infections do we see in our diabetic patients? What's very common?
Infections and diabetes.
Mhm.
Oh, metabolic acidosis.
That's an acid-base imbalance, but it's not an infection, right?
But like, couldn't that be like with the kidneys and
Yeah, but it's not an infection.
no?
That's like what happens when they come in and like decay, right?
Mhm. Oh,
Remember, they get a lot of UTIs and they get a lot of yeast infections because bacteria loves more moist environments and they've
mhm.
got a ton of sugar. And bacteria and yeast have to eat to survive. So they eat the sugar from the diabetic's blood,
Mhm.
right? So they get UTIs, yeast infections. They get ulcers on their legs that get really infected,
Okay.
right? Yeah, a
Mhm.
lot of times they have to get their legs amputated, right?
Mhm.
And then if a diabetic patient gets sick, it just takes them a long time to recover because their body is already I wouldn't say it's immunocompromised, because to be immunocompromised means like your immune system is not intact. Their immune system is intact. It's just been under so much stress because it's having to work so hard to do basic body functions, right? So someone with a chronic illness, think of like, okay, somebody with lupus or somebody with cancer or somebody like, can you imagine what their body goes through on a daily basis? Do you think their immune system is going to be perfectly intact? No, and they're going to have a harder time recovering from an infection, okay? Neonates, why are they at risk of infection? Do you know what a neonate is?
Sounds familiar, right?
Yeah. What does neo mean? The word neo. New. Brand new baby. So a neonate is a brand new baby.
Okay.
And why are they at risk of infection?
Their immune system is just not.
They don't have one, right? Their immune system is not fully developed until they're 1 year of age. So that's why neonates are at high risk of infection, because they don't have quite an immune system yet. They don't have a gut microbiome. Their gut is sterile when they're born. They haven't developed a gut microbiome. And we know that that's very important for your immune system, right? Like 80% of your immune system is in your gut. So if they don't have that microbiome yet, then they're at risk of infection. All right, immunization status. So if they are not immunized, they would be more at risk of getting whatever it is that they are not immunized against. Okay. Chronically stressed. Why would that put you at risk of infection? Welcome to nursing school, right? Right? Nursing students get sick all the time. How come? Stress. What hormone is released during stress? Starts with the C. Cortisol. And cortisol decreases your immune system because it's trying to help you deal with other things at that time. So patients that are chronically stressed have a lower immune system. They're much more likely to get an infection, which is why during finals, people get sick all the time, right? Because you're really stressed. Okay. Any indwelling devices. What does that mean? Foley. What else?
NG tubes?
Maybe NG tubes, but more like invasive, like IV, central lines, anything that's going into the body that's actually like penetrating the skin barrier is going to put you at risk of infection, right?
Because the sterility.
Because what?
The sterility?
Maybe they weren't sterile. Maybe it wasn't cleaned very well. And like IVs go directly into your blood. So if it's not cleaned properly, that bacteria can just crawl directly into your bloodstream, right? All right, we're going to talk about signs of local infection versus systemic infection. What does local mean?
It's just in one part.
One area. And systemic means all across your whole system. So signs of local infection would be erythema. What's erythema?
Red.
And edema?
Pitting.
It can be pitting, but what does edema mean?
Indentation?
You can have edema that is pitting or that is indented, but what is the term? If I just said, hey, that patient there's really edematous, what would they look like?
What they look like is like they have the indents.
Sometimes they have indents, but just because someone has edema doesn't mean they have pitting edema. That's like grade 4 edema. So there's 4 different grades of edema. So edema just means to be swollen. Okay. So like if they just had 1 plus edema, that's just when you push it, it's a little swollen, but there's no indentation.
Right.
Okay. 2 and 3 are also like very swollen, but 4 is pitting edema where you push on it, you let go and it stays. But the word edema just means swollen. Okay. So I could say like, let's say you come in and a wasp stung you. That's edematous because it's swollen. Okay. But you don't have pitting edema, right? Okay. Heat. So it's hot in the area. Why is it hot in that area? You ever like got stung by something and you feel it's like warm to the touch? Why is that?
Your body's responding to the heat. And
How does it respond? Your body needs help somewhere, right?
Ready.
Your body does need help, right?
Yeah.
Okay. So let's say you get stung by a wasp right now. Okay. How's that going to feel?
It's stinging. And
why does it hurt? What's it trying to tell you? Something's wrong. It's telling you something's wrong. Pain is our way of saying
something's wrong.
Right. So every time I go, you're going to say
something's wrong.
Right. So you get stung, it hurts. That's your body's way of saying, all right, it's going to need a lot of stuff to go to that area. It's going to need white blood cells. It's going to need red blood cells. You're going to need inflammatory markers to come and heal that area that got stung. How do things travel in your body? How does it get there?
Cells.
It'll go into the cells, but how does it get there? It has to actually travel. How does it travel? How does anything travel through your body? Exactly. So how do I get it there faster through my bloodstream? I'm going to
Vasodilator?
Yes.
Okay.
So the heat is coming from vasodilation. Anytime, anywhere in your body, something happens and your body says,
Something's wrong.
you will vasodilate.
Okay.
And it will bring more things to that area. That's why if somebody hit me in the arm with a baseball bat, what would that area look like?
It's all expanding and
It's swollen, it's edematous, because why? I vaso.
dilate.
If somebody punches me in the face, what's it going to look like immediately?
Big ball.
Red,
Yeah.
right? There's going to be swelling and there's going to be redness because I vasodilated. My body said,
Something's wrong.
and it vasodilated to get a lot of stuff to that area. You with me?
Yeah.
That's also why there's erythema, which is what color?
Red.
Right. It's red because you have
Swelling. and
vasodilated.
vasodilated.
Yeah. Okay. So that's local signs of infection. So and drainage as well. So let's say, you use like a curling iron, straightener, anything like that? Okay. You ever burned yourself on it?
Yeah.
Yeah. That hurts like hell. I know.
Yeah.
So as soon as it hits your skin, your body says, something is wrong, and it vaso, and it brings a bunch of what color? It's going to be red, and then it's going to get very swollen because lots of fluid comes out to that area because it's vasodilated now, right? Right? What does it look like on the second day?
It gets bigger.
And it blisters.
And those-
That's a lot of fluid that is third spaced in that area. So
Okay.
there's erythema and edema, and then that blister pops, and what happens? Drainage.
fine.
Exactly.
Okay.
Okay. Versus systemic infection. So systemic means
It's all over the body.
it's all over the body. So now it has spread everywhere. Oh, sorry. Rubor is like a red color.
Oh, it's just red.
It's red.
Okay.
Rubor means red. Think of it like a ruby.
Uh-huh.
What color is a ruby?
A red.
Exactly.
Oh.
Okay. All right. Signs of systemic infection, meaning somehow the infection has gone into your body. It is now traveling through your.
Oh, you mean wait, is it ruby?
How do things travel inside your body?
Bloodstream.
Okay. So now it's gone.
It's all over the body.
That's bad.
Mhm.
That's really bad. Okay. So you may see leukocytosis. What is leukocytosis?
Like blood cells?
What happens to them? What does it mean? Leukocytosis is what?
Oh, damage to the white blood
Well,
cells?
leukocytes are white blood cells. So leukocytosis is a
Infection.
increase in white blood
Increase
cells.
in-
Leukocytosis means,
Increase in white blood cells.
and why would you have an increase in white blood cells? What's their job?
So,
White blood cells do what?
um,
Fight infection. White blood cells,
fight infection.
white blood cells.
Fight infection.
What is leukocytosis?
Increase in white blood cells.
Right. So if something has happened to your body, you have an infection, you need something to fight it. Who fights it?
The white blood.
The white blood cells. So they're going to increase. What's a normal white blood cell count? If you don't know, just say, I don't know. All right, write it down because you need to know all your labs. It is 6,000 to 12,000. What's a normal white blood cell count?
6,000 to 12.
6,000 to 12,000. So leukocytosis would mean your white blood cell count is greater than 12,000, right? All right. Another sign of systemic infection would be fever. And for nursing school, it's very important to note that we do not consider it a fever until it's greater than 100.4. Okay. If a patient comes in, they're like, oh, I'm so sick. I've got body aches. My temperature is 99.3. You would say, cool. Yeah. Okay. That's fine. Okay. It's not a fever until it is 100.4. Okay. And why do you get fever in your body? Why do people get fever when they're sick? What's the purpose? What's inside your body when you have an infection? Yeah, like what could be what's causing the infection?
Bacteria.
Okay, could be bacteria, could be virus. Okay, how do we kill those things?
Antiviral.
Okay,
drugs.
how does before there was all of that? If that was the only thing that killed them, we would have no human race, right?
Yeah.
Because there wasn't antibiotics and there wasn't antivirals back then, right? All people did was run a fever.
Yeah.
So what it does is it heats up your body to the point where the viruses and the bacteria can't survive. We know that in order to clean something, we add heat to it, right? Because like back in the day before they had sterilizers, they would take whatever scissors they were using and put it over a stove or fire, because fire and heat kills viruses and bacteria. Your body has that naturally built in. It's a fever. Okay. But what do we do now when someone runs a fever? We give them Tylenol or Motrin.
Yeah.
Why? Pharmacology, exactly. Your body knows what to do. You're supposed to let them run the fever. Okay. Now, if the fever gets to a dangerous level, sure, we can treat with some antipyretics. That's like Tylenol or Motrin. right?
Mhm.
But in the like we really need to let people run a fever. That's your body's way of heating it up from the inside so that the virus and bacteria can survive.
So it's considered not a bad thing.
Right.
Those
It's a
are
very good
good.
thing. It's a protective thing.
Okay.
Yeah. So, but you see us medicate all the time, right?
Yeah.
But I don't say like when I have patients come in, because I work at urgent care,
Uh-huh.
and they're always like, "Well, do we need to give Tylenol or Motrin?" I'm like, "Well, how's he acting?" They're like, "Oh my God, he's bouncing off the no." If they're acting fine, I say, don't let your body do what your body's meant to do, right? Because what's going to happen if I keep decreasing that kid's fever?
The bacteria is still
The bacteria, the virus is still going to thrive, right? Let it do what it's going to do. Now, I always say that, I mean, if they're having, a lot of kids will have like severe headache, even adults with a fever, or they look miserable, that's fine to treat them. Okay. But if the kid is running around and playing or they're manageable, let your body do what your body's going to do. Okay. All right. What is malaise?
Weakness.
It's not weakness.
Not weakness.
Mm-mm.
Discomfort.
Kind of. It is like the nursing term for I feel like shit.
Okay.
Like I just feel very unwell. If you were to get like a nursing term for it, it'll probably say a general feeling of unwellness.
Okay.
I say I feel like shit. Okay.
Okay.
Because that's what it means is I feel bad. You know, like that feeling you get when you're like about to get sick, but you don't have symptoms yet. You're like, oh, I think I'm coming down with something. I don't feel good. And you're like, oh, what's wrong? You're like, I don't know. I just don't feel good. It's a general feeling of I just don't feel good. Okay. What is anorexia? That's if they have an eating disorder. That's anorexia nervosa. That's an eating disorder where they're very thin. Anorexia in nursing school just means I don't have an appetite. Okay. So I could have anorexia today because I don't feel like eating. Well, obviously I just ate, so that's not true. But anorexia doesn't mean the eating disorder. It just means I don't feel like eating. And most people, when they're sick, you don't feel like eating. Now, if they say anorexia nervosa, that's the eating disorder where they intentionally are starving themselves. They're very underweight. Two very separate things. Okay. All right. Fatigue. Why would they feel very fatigued with a systemic infection?
That's the whole body is just.
It is fighting very hard. All your white blood cells are increased, and it's in a war with this virus or bacteria. Because when your body gets a virus or bacteria, what's it trying to do? What's its main job? What does it want to do to your body?
When your body gets a virus or bacteria?
Yeah. What does the virus or bacteria want to do?
It continues to grow.
It wants to take over your whole body. So you got to go to war with this thing. So your body's like, I can't do both.
Yeah.
Right? Okay. Increase ESR and CRP. What is an ESR? Have you heard of it before? All right. ESR is a blood test, and it stands for, you can write this down. You're probably going to have to use some Post-its because you're not going to have enough room. It stands for erythrocyte sedimentation rate, ESR. You may also hear it called a sed rate, but usually we call it an ESR. And what this blood test is it will be increased when you have inflammation or infection. So it's what we call an inflammatory marker. So
a blood test that increase inflammation.
In inflammation or infection, it'll be increased. Okay. And it's the same concept with the blood. There's another blood test called a CRP, and that stands for C reactive protein.
C reactive
protein. So we run these together. I'll draw an ESR and a CRP. And if they're both elevated, that tells me this patient either has a massive
infection
or a massive inflammation. Very good. Okay. So these are what we call inflammatory markers. Okay. Why would a patient have a high respiratory rate with a systemic infection?
They're breathing too fast.
Oh, yeah, I did say respiratory. It said heart rate, and I was like, why is she talking about breathing? And then I was like, replay. Okay. Yes, increased respiratory rate does mean they're breathing too fast, but why?
It's the body's way of cooling down.
Actually, yeah. Oh my God. Okay. So you have a fever. We know we lose a lot of it's hot. Yeah? Okay. So yes, your body is trying to get rid of it. And also this is a compensatory mechanism to not only get out heat, but to get in more oxygen because you're having to fight a battle and your oxygen is going to be rapidly used up by having to fight infection. Okay. And increased heart rate. Why would you have an increased heart rate? Tachycardia. Why? What's it trying to give you more of?
More blood.
What's in your blood that helps to fight infection? White blood cells. There we go. We're compensating. Okay. Now, high fever can also give you a really high heart rate because your body's real hot,
Yeah.
right? And it's trying to cool you down a little bit too. Okay.
Mhm.
So a lot of these can be compensatory for lots of different things. Okay.
Mhm.
All right. Two big terms you need to know for this module would be medical asepsis. Let's break down that word. Sepsis means what?
Oh, wait. A technique?
No, the word sepsis means bacteria in the blood.
Bacteria.
Sepsis means
Bacteria in the blood.
and the word A means anytime you see A in nursing school, like agranulocytosis, apnea. A or AN means without. So now put those two without.
Without bacteria.
There you
Oh,
go. Okay. So asepsis is trying to get without
bacteria.
bacteria. So medical asepsis is what we're doing like normally. We're just using clean technique. It doesn't have to be sterile, it's just clean medical asepsis.
Okay.
Now, when a patient goes into surgery, any teeny tiny amount of bacteria could kill them because we've got them open and we don't want to get the bacteria in their body, right?
Mhm.
So surgical asepsis is using sterile technique, okay, where you're using all the PPE. Okay. So medical asepsis is clean technique. That's where like you're going to wash your hands, you're going to use regular gloves, you're going to do the normal like, infection prevention. But surgical asepsis, you've seen Grey's Anatomy, right? Did I ask you that? Okay. You know when they go into surgery, what do? They have to scrub for a long time and they walk in like this and somebody gowns them and they're wearing a mat, right? Because I can't have any tiny bit of bacteria in there. So that's surgical asepsis is sterile technique. Sterile gloves, everything has to remain sterile. Okay. All right, let's look at medical asepsis. So these are the things that are included. This is what you're supposed to do on a normal med-surg unit all day, every day. These are things that you are expected as the nurse to do. Okay. Good hand washing. Did we know that was coming? Yes. All right, for at least 20 seconds. Good hand washing for at least 20 seconds. All right. You can provide tissues to the patient, but don't I'm touching your stuff. Okay, I will give you your tissue and then you can throw your tissue out. I'm not touching. No. We don't do that. Okay. All right. Push away, not towards you. What does that mean? Anything you're doing with a patient, I am always pushing away, not towards. Think as if you're wiping a butt. Okay. You got a big giant butt right here. Are you going to wipe them this way towards yourself? No, I'm wiping this way. Say I've got a big wound right here. I'm going to wipe away. What happens if I wipe? It's going to go on you. Okay. So you always want to wipe away, not towards you. This is a huge one. Empty the sharps when it's 2/3 full. This is always on ATI and always on NCLEX. You know what the sharps container is, right? Okay. When it's 2/3 full, you empty it because if it gets too full, somebody's going to get a needle stick. Yeah. Needle stick. Okay. So in order to prevent that, make sure you change it when it's 2/3 full. Okay. We make sure to sterilize any equipment. That's a given. Use gloves. No fake nails. That's disgusting. Okay. Do you know how much fungus is under fake nails? And then you're going and providing care like in a NICU? Okay. What did I tell you about your hair? Always back. Right. Because what happens if you're touching MRSA and then you go like this or C. diff? Okay. Gross. No rings. You are not supposed to wear your engagement ring. You're not supposed to wear your wedding ring. How come? That can also just hide in. Oh, tons of bacteria. I don't know. Somehow I know TikTok listens to me all the time. I know that. But because I talk about weird stuff in here, and I've talked about this a million times. So on my TikTok, it started showing feeds of people like bringing in their wedding rings for cleaning and they put them in this cleaning solution and all this like black stuff is just like bubbling out of it. They are super, super dirty. Yeah. Not to mention they can cut through your gloves. Right. Especially if you have a really big, nice diamond ring. Yeah. It can cut through. And I've seen people throw away their rings accidentally when they take their gloves off. It just, it belongs nowhere. If you want to know, want somebody to know that you are taken, usually people just wear like a black band or something like that. Okay. All right. Use an alcohol-based sanitizer if your hands are not visibly soiled, and then you should rub it in for at least 15 seconds. But if you have any body fluids on your hands, that's disgusting. Yeah. Yeah. But remember, you cannot use alcohol-based hand sanitizer for C. diff. Okay. It's resistant to that. You have to wash with soap and water for at least how many seconds? Soap and water. Soap and water. Very good. 20 seconds. Nice. C. diff is resistant to alcohol? To alcohol-based. Yeah. Okay. It has to be washed with soap and water. Okay. You with me? Okay. All right. let's go to a needle stick. They love to ask questions about needle sticks.
Mhm.
Okay. Now, hopefully this will never happen. But if they say, what is the very first thing you do if you accidentally stick yourself with a needle? Good hand washing.
Okay.
So this time you are going to wash it for 5 to 10 minutes and let water just run over it. Wash it with soap. You basically just want to like rinse off that whole nasty whatever you got stuck. Okay. Then you're going to go to the charge nurse and say, girl, I got some really bad news, because they're going to be pissed. Okay. So you go and tell the charge nurse, and then she's going to send you down to the ER where you're going to have to get tested for like HIV and hepatitis. Now, can you get HIV and hepatitis in 20 minutes from a needle stick? No. Why are they testing HIV and hepatitis that day?
You could probably travel.
What? In 20 minutes.
Um,
Okay. Let's say you get a needle stick. 3 months later, someone, oh, I won't put it on you. Let me put it on somebody else. A nurse gets a needle stick. 3 months later, she gets her blood tested again, and she's HIV positive, and she wants to sue the hospital because she got HIV from this needle stick. What do you think the hospital is going to ask?
Did we do a blood test?
Are you sure that she got HIV from the needle stick? How do we know she didn't already have it?
Mhm.
Right? So you get tested that day to make sure, because they're not going to be responsible for that if you already have it, right? And then they will ask your patient, would you mind, your nurse got a needle stick, would you mind if we tested your blood? They have the right to refuse.
Mm.
Okay. So then the nurse has to decide, do they have enough risk factors where I'm going to go ahead and take medicine to prevent getting HIV and hepatitis, or I think I'm okay.
All right.
Okay.
Yeah.
Like if I was in the NICU and there was a needle stick and I know mom had already just been tested the day before for HIV and hepatitis, that baby doesn't have it.
Yeah.
So chances are I don't have it. But if I'm on a med surg unit and they have a lot of risk factors, and this isn't meant to be like stereotypical, but these are risk factors for it. If it was a homeless patient, right, that was an IV drug user,
Yeah.
you know what I'm saying? Like if they have multiple risk factors, I'm probably
Right.
going to take the medicine.
Right.
Okay. All right. So what's the first thing you do if you get a needle stick? Hand wash for how long? 5 to 10 minutes at
Okay.
least. Okay. And then you're going to report it to and then you're going to go down to
Get tested.
you're going to get tested, and then they will offer you, if you look at number 4, PEP is offered. What is PEP? Post exposure prophylaxis. So post means after, right?
Yeah.
So after you get exposed, and then what does prophylaxis mean? Like if I say, hey, you're going to take this medication prophylactically, that means you don't have the disease. We're trying to prevent it. So you're taking a medicine to prevent it. Okay. So let's say you're a patient that gets UTIs all the time and it's causing kidney scarring. They may put you on a little bit of antibiotics every day. Do you have an active infection? No. What are they trying to do? Prevent it. So prophylaxis means to prevent. Okay. So they will offer it to you. You don't have to take it, but they will offer it to you because it is very hepatotoxic. It's really damaging on the liver. So you have to decide what you want to do. Okay. And then they will follow up test you at 2 months, 4 months, and 6 months. You have to go back to the ER and you have to get retested because it can take that long for HIV or hepatitis to show up in your blood. If at 6 months you're negative, then you're fine and you're good to go. Okay. All right. Let's see. Let's go to preventing HAI. Do you see it on the right side?
Oh, what's the F/U?
Follow up.
Okay.
Yeah, you're gonna have to learn all these acronyms. So if there's something you don't know, definitely ask me because I forget your first semester sometimes. All right. Preventing HAI. What is HAI?
Hospital infection.
Hospital acquired or hospital associated or healthcare acquired. It could be a lot of different things. But yes, basically, you went to the hospital and you got infected, but you weren't infected when you came in. Okay. This is what we also call nosocomial infections. That means from the hospital. Nosocomial means from the hospital. Okay. All right. There's 3 different ways that you can get this. Exogenous. Exo means from the outside. So that was from patient to patient. Like you said at the very beginning, you could go and clean an MRSA wound and you didn't use the proper PPE and you didn't do things correctly. You didn't wash your hands well. And then you went and cared for the next patient and then they got MRSA. Okay. That's outside, right? There's endogenous, meaning you get an infection from inside the patient. So this would be like a CAUTI. What's a CAUTI?
Anything to the UTI?
How do you get a UTI in the hospital? What causes them?
Oh,
Catheter associated UTI.
okay.
So that's when you put a Foley in when they didn't need it, or it was in too long, or you didn't clean properly,
Mhm.
and they get a CAUTI. So that would be something that was inside the patient and they basically got infected from it.
Okay.
Okay. And then there's iatrogenic, which means you got it from a surgical procedure, which
Mhm.
means they didn't use proper PPE or somebody broke sterile fields. You know,
Mhm.
you've seen Grey's Anatomy, they break
Yeah.
sterile field all the time.
Mhm.
Somebody passes out on the floor or somebody farted. I don't remember. Do you remember that episode where somebody farted and they were like, who did it? Who did it? And they're like, whoever did it, get it. No, okay, cool. Well, you'll get there. All right. You,
Meredith's ring popped out? Or
yes, yeah, I told you rings
nails?
will do it or nails will do it. Yes, you got to be careful with those. All right, you have to report these as what we call a sentinel event. They're called a sentinel event, which means it was an event that was not supposed to happen but did,
Okay.
but you don't record it like that in the chart. Didn't we talk about that? You
Yeah,
don't write it down on the
separate
chart, but
thing.
you do, it's a separate thing. Okay. All right, most common locations that we might see an HAI would be from a CAUTI, which is from a
Catheter associated infection.
yes. All right. A central line, which has to be clean using what type of technique? Surgical or sterile technique. Okay. A surgical site, obviously.
Mhm.
And then what's VAP? Have you heard of that before?
Mm-mm.
It's in the ICU mostly. The P is a type of infection, very common infection in the lungs. It is pulmonary. It was in the lungs, but what's a very common infection that people get in their lungs all the time?
Oh, tuberculosis.
Well, it's not very common.
Oh.
You're right, it is an infection, but it's not very common here. What's the most common infection of the lungs?
COPD?
Oh, you know this. COPD is not an infection. You're thinking too hard.
I think. What does it start with?
P. But it doesn't start with a P. It starts with a N. Okay, so pneumonia. The V and the A is ventilator associated pneumonia.
Okay.
So these are patients that are on a ventilator and basically the bacteria just crawls down the ventilator and into their lungs and gives them a pneumonia. Okay. Most common bacteria that we see for nosocomial infections would be C. diff. Where do we usually see C. diff? What organ?
Denise? Wait, ow.
You can smell it all the way down the hallway. C. diff. Once you smell it once, you will never forget it. It smells awful.
They were talking about that. They smelled someone that had it. But it was something else, a very unique smell.
What do you get C. diff from? How do you get C. diff? Mm-hmm.
Does it have something with the feces?
So this is a stool issue, right?
Okay.
Now, C. diff usually happens because patients got too many antibiotics back to back. Remember, you have a whole gut microbiome and antibiotics kill you, all right?
Yeah.
Okay. Kill all the good and the bad bacteria. And so it'll allow the overgrowth of bad bacteria like C. diff.
All right.
C. diff is a poop issue. But you can also pass C. diff from person to person if you didn't clean very well after cleaning up a C. diff patient.
So what organ is that?
The intestines,
Oh, okay.
right?
Uh-huh.
Isn't that where your poop comes from?
Yeah.
Okay,
Oh,
just
okay.
checking. Okay. E. coli, where's that from?
Also from reproductive.
Yeah.
Okay.
No, not intestines.
Intestine.
It's a gut thing.
Okay.
Your whole gut is filled. Your gut is filled with E. coli. Everybody's is. But with the problem is when E. coli overgrows, then that's when we have a problem.
Okay.
All right, Pseudomonas. This word I want you to remember because you'll have it in every single class. Pseudomonas is wet and weepy.
Right.
Wet and weepy. And that sounds gross, doesn't it?
Oh, yeah.
It's just oozy green. Pseudomonas is oozy green. And it could be anywhere. It could be in a wound. It could be in an ear canal. It could be literally Pseudomonas can be anywhere, but it is always wet and weepy and almost always green.
Okay.
Green and oozy. Okay. Yeah, wet and weepy, green and oozy. All right. Staph aureus. Now, staph could be anywhere, but typically it's in a wound, right? Strep fecalis. Where's that? Fecal. That's intestines. Okay. Klebsiella could also be anywhere, but sometimes we'll see it like respiratory. There's a Klebsiella pneumonia that we sometimes will see like with cystic fibrosis patients. You can also get a Klebsiella UTI. So it can be lots of different places too. All right. A drug-resistant HAI. Now, these are the big, bad, ugly ones. So what happened was we were giving antibiotics to everybody. And then these bacteria, they got resistant to the antibiotics, right? So now they will have this on their door if they have this type of any kind of these drug resistant bacteria. So that way, when you walk in, you should have full PPE on because I'm not about to spread some kind of MRSA to everybody. Okay. So let's start with MRSA. What does that stand for?
Methicillin resistant Staph aureus.
Very good. Methicillin resistant Staph aureus. Obviously, penicillins don't kill it. Okay. And MRSA can literally be anywhere in any body fluid. Okay. What is VRE?
Wait, you just put
Sorry, yeah.
MRSA, you said penicillin does not kill it?
No, because it's called methicillin resistant.
Yeah.
So it's resistant to penicillin.
Okay.
Yeah. Any penicillins. Anything that ends in cillin, it's resistant.
Oh.
All right. So your drugs of choice for that would be vancomycin or linezolid. Those are the only two that are going to kill it. Okay. And then we've got VRE. What is VRE? Well, you know what the R and the E probably stand for, right? Oh, maybe not the E, but maybe the R. Same as for MRSA. What does R stand for?
Oh, resistant.
Resistant. Okay. And the E is enterococcus. So that's a type of bacteria. What's the biggest, baddest antibiotic? The one that we use for the big, bad, ugly ones. Like if you hear that a patient's on this antibiotic, you're like, oh, dang, they must have a bad infection because that is a big daddy antibiotic. Starts with a V. Ends with an ancomycin. Vancomycin. That's right. How'd you know? Yeah, vancomycin is a big daddy of antibiotics. All right. It covers a lot and it is a very heavy antibiotic. So if you have VRE and your bacteria is vancomycin resistant, oh boy, we got a problem, don't we? Okay. So the only one you can use for that one typically is linezolid. There is a one that's emerging called CRE, which the R and the E is the same as the VRE, so it's resistant enterococcus, but this one is carbapenem. It's it's another antibiotic, and we don't know how to treat it. If you get it, we're like, oh, I'm sorry, that happened to you because I don't know how to treat it. Okay. And then C. diff. What do we say C. diff was caused by?
Intestines. There's wait.
All right, so C. diff is bacteria. It is in your intestines, usually because you've given too many antibiotics. Okay.
You were given too many antibiotics.
And it wiped out your gut. Yeah, you got C. diff.
Okay.
Yeah. Okay. And then you have to treat it with more antibiotics. And you treat it with vancomycin, the big daddy. Okay. All right. You should already know not to recap needles, right? Okay. And all needles go in the sharps. And when do you refill the sharps?
You throw it out when it's 2/3 full.
2/3 full. Very good. All right. For PPE, just big things to note is to wear gloves when you're in contact with any body fluids. Never leave the room with your gloves on because that means that you've touched with your C. diff hands. Nope. We use latex-free gloves because a lot of people are sensitive and may not even know it, right? Okay. And do not put the mask around your neck and then reuse it because then you'd have to grab it with your C. diff hands. Okay. So, well, if you pull the mask off and you have gloves on, that's it. You're done. You need to replace everything. Okay. N95 mask. You've heard of this before. Y'all had to get fit tested, didn't you?
Yeah.
Yeah. So, N95 is for airborne precautions and it must be fitted to you and you have to get a fit test. Okay. Standard precautions are the precautions that apply to every patient. Things you should do like hand washing, wearing gloves, wearing PPE, normal PPE, coughing like this, cough etiquette, right? Okay. So it's doing the things that you should normally do to decrease infection. Transmission-based precautions, that's our airborne droplet in contact. Does that make sense?
Yeah.
Questions on what we've covered so far?